Okay. Ready to dive into some serious oral anatomy today.
Oh, yeah, I'm excited.
You sent over a whole stack of notes and articles.
I did. I'm ready to learn some stuff.
Yeah. And I'm not going to lie, I was intimidated at first.
Yeah.
There were some big words in there.
Right.
But I feel like by the end of this, we're going to be
I think so, too.
feeling like experts.
We'll know all the terms.
Yeah.
It's going to be great.
We'll be throwing around all the lingo at our next dental checkups.
Exactly. The mental foramen, the
Nice.
incisive canal,
Well.
all that good stuff.
So speaking of the mandible,
Okay.
which I've always just called the jawbone.
Well, I mean, you're not wrong. The mandible is the jawbone.
Okay.
It's the lower jawbone shaped like a horseshoe.
Okay.
And it has this very important canal running through it.
A canal, like the Panama Canal.
No, not quite that big.
Okay.
But picture it like a highway or a protected tunnel that's carrying all these vital nerves and blood vessels.
Oh.
And we call these the inferior alveolar nerve and vessels.
Inferior alveolar nerve and vessels. Okay.
Yeah, and just like any good highway, we have exits or branches.
Right.
And those are called the incisive and mental canals.
Incisive and mental canals. Got it.
Yeah.
Now, you mentioned mental,
Yes.
and I saw in the notes the term mental foramen.
Yes.
So what's the big deal about the mental foramen? Like, why are dentists always so concerned about that?
So the mental foramen is basically an opening on the outer surface of the mandible,
Okay.
right around where your premolars would be.
Got it.
And it's basically where that mental nerve we were just talking about
Mm-hmm.
exits the bone.
Okay.
So if a dentist isn't careful during surgery around this area, they could damage the nerve,
Right.
which would lead to...
I imagine that would not be a good thing.
No, it would not be a good thing.
Right.
You could have numbness or altered sensation in your lower lip and your chin. Oh.
And there's also another nerve
Oh, God.
called the lingual nerve that runs close by on the inner side of the mandible.
Okay.
And that one's particularly vulnerable during procedures like molar extractions.
Okay. So dentists really have to have like a roadmap in their head
Absolutely. Yeah.
of all these
This
nerves
is incredibly important.
before they go poking around.
Yes.
Wow. Okay, so we talked about the mandible. What about the upper jaw?
Okay.
My notes are calling the maxilla the unsung hero of the face.
Yes. The maxilla is amazing.
Why is that?
It does so much more than just hold your upper teeth.
Okay.
It shapes the contours of your face. It forms the floor of your eye sockets. And it even contributes to your nasal cavity.
Wow. Okay.
And tucked away inside the maxilla, there's this incredible space called the maxillary sinus.
The maxillary sinus. You see, when I hear sinus, I think
Right.
sinus infection.
Yeah.
But I don't think of like up by my cheekbone.
I know.
You know what I mean?
Yeah, but that is where the maxillary sinuses are.
I think there's one on each side.
Okay.
They're large, air-filled cavities lined with a special membrane.
Okay.
And these sinuses, believe it or not, play a role in your voice resonance.
Wow.
And they even help to lighten the weight of your skull.
Okay. So they're overachievers.
They are.
That's amazing.
Yeah.
Now, the notes also mention some nerves in this area
Yeah.
that dentists need to be aware of.
Yes, that's right. We have the nasopalatine and greater palatine nerves
Right.
running through the roof of your mouth.
Okay.
And alongside those nerves runs the greater palatine artery.
Okay.
And if that gets damaged during a procedure, it can cause a lot of bleeding.
Oh. Okay, so it's not just about bones.
Right.
It's also about all the soft tissues like the nerves and arteries.
Exactly. And let's not forget muscles.
Oh, right.
You probably don't think about the muscles in your mouth very much,
Right.
but they're essential for everything from chewing to smiling.
Wow. Okay, well, I have a question about two muscles
Uh-huh.
mentioned in my notes.
Yeah.
The mentalis and the buccinator.
Yeah.
What role do they play when it comes to dentistry?
So imagine you're a dentist and you're doing periodontal surgery,
Okay.
which often involves working with gum tissue.
Right.
You might need to create something called a mucogingival flap,
Okay.
which is basically lifting and repositioning the gum tissue to access the underlying bone.
Sounds delicate.
It is delicate.
Yeah.
And that's where understanding these muscles comes in.
Okay.
The mentalis muscle is the muscle that lets you pout your lower lip,
Okay.
and it attaches close to the gum line.
Got it.
The buccinator muscle is in your cheek. It helps you smile and move food around.
Okay.
So knowing where these muscles attach is crucial to avoid damaging them during surgery.
Wow, so it's really like a very delicate dance that they have to do.
Yeah.
Now, there's one more thing in the notes that I have to ask about.
Okay.
I'm intrigued and a little creeped out.
Okay.
Anatomical spaces? Tell me about these hidden compartments in my mouth.
All right, so think of them as potential spaces that can open up under certain conditions like an infection. So the buccal space, for example, is between your cheek and your jaw muscles. So if you get an infection there, your cheek can swell up like a balloon.
Ouch.
Yeah.
What about the other spaces?
Okay, so we also have the sublingual and submandibular spaces, which are under your tongue and beneath your jaw.
Got it.
And these spaces contain vital salivary glands and nerves that control your tongue movements. So an infection there can make it painful to swallow or speak.
Oh, wow.
And in severe cases, it can even lead to a dangerous condition called Ludwig's angina.
Ludwig's angina. That sounds terrifying.
It is. It's a severe infection that can spread very rapidly and potentially block your airway.
Wow.
And then finally, we have the submental space, which is right under your chin. And infections there can also cause noticeable swelling.
So it sounds like infections in these spaces are not something to mess around with.
Absolutely not. And this is where that detailed anatomical knowledge becomes so important for dentists. They need to understand how infections can spread through these spaces and how to treat them effectively.
Wow. So we've gone from the mandible to the maxilla.
We have.
We've explored these hidden spaces. We've talked about muscles I didn't even know I had. What's the big takeaway for our listener today?
I think the biggest takeaway is that the mouth is an incredibly complex and interconnected system.
It is.
Every structure plays an important role, and understanding that complexity is really crucial for good dental care.
It's so true. And now I feel like thanks to all this research and this deep dive, you listening out there have a much better understanding of that complexity.
I hope so.
So next time you're in the dentist chair, you can impress them with your knowledge of mental foramina and buccinator muscles.
Exactly.
And remember, regular checkups and good oral hygiene are the best ways to keep all of those intricate parts working in harmony.
Couldn't agree more.
Thanks for joining us on this deep dive.
Of course. My pleasure.
Until next time.
See you then.